welcome back to my channel. Today I'm just gonna do a quick little video. We had our 20-week anatomy scan done. Today's Friday. We had it done on Tuesday. Sorry for the way that I look, don't mind me. I am completely exhausted. Jeremy and I were up pretty much all night with Elijah. We don't really know exactly what's going on. He's just had a fever pretty much on and off all day. And he's just real whiny. Last night he was saying that his stomach hurt. So I'm not really sure if he has the flu or what, but needless to say, we are all exhausted around here. Anyways, so we went for the 20-week anatomy scan, which I was actually, because I'm 22 weeks, so I was 21 weeks in a few days. And everything was going good. Everything was fine. Baby was not very cooperative. Basically the sonographer said that he was in a ball. So she was having a hard time trying, getting the pictures that she needed. She was able to get some, but not all of them. She had me roll on one side, she had me roll on the other side, she had me get up to use the bathroom, and it really didn't move him out of his ball that he was in. Now, I know we had mentioned this before, we did our gender reveal, so everybody knows that we had the genetic testing done, which was able to determine the gender, and they did double confirm it at this ultrasound. So, that was already confirmed again. We got a picture of that. There's a funny story behind that picture, but I don't know if it's really appropriate for YouTube, but, I'll add the pictures in this video and then you'll be able to tell. So everything was going really good. We weren't able to record in there, and it just, it's the same for, some people can record, but anyways, I don't want to make this too long. Long story short though, because of the position that he was in, and he was being stubborn and he would not move, she couldn't get the pictures that she needed. So she had the doctor come in, or the perinatologist come in, and he tried. And he said, everything that I am able, all the images and all the pictures that I have seen and what I'm able to see with the ultrasound, everything looks great. But we're going to need you to come back in a couple weeks just to get the rest of the pictures. So, there's not much you can do about it, we were sitting there for an hour and a half to 2 hours. So they, probably had other patients that they needed to see. So I'm just looking at it as another ultrasound that we're going to get to have, another detailed ultrasound. Now, we're hoping that the next ultrasound, we get a different tech, just because the vibe was not, I don't know. I don't want to talk about people, but the vibe was just not right. The last person that we had, she was funny, she was great, we were talking, having a good conversation, and this one just, I don't know. But yeah, so we are, the perinatologist said to come back in 3 weeks, so we are rescheduled, or we scheduled the follow-up anatomy scan for May 15th. So we will know more then, but as far as everything that was, that we could see, everything was great. So we're, real happy to hear that. Due date is still the same, September 1st. Is he okay? Sorry, Elijah's in the bathtub. Due date is still September 1st. And he said that the baby weighs, he didn't give me his length, but that was because he was in a ball. They couldn't measure his length. But he said he weighs about 1 pound. So for 22 weeks, well, I was 21 weeks, he's already 1 pound. So he said that's pretty good, that's normal. and on point for his gestational age. So everything worked out really good. I'm really happy that, you know, there was no issue. We had the genetic testing done, so we knew that they're, you know, what they were testing for, that was all negative, so we were fine. We knew that. And then what they were looking for at the 10-11 week scan, that came back fine too. So I'm not too worried about anything being wrong. I mean, obviously there's still a chance, but I think we're pretty good. Everything's going pretty smooth. But yeah, I'll give you guys an update after that ultrasound. Maybe I can do, because I'll be about 25 or 26 weeks. So maybe I'll just do a full like pregnancy update at that point, because I'll be 6.5 months. I'm 5.5 months now, so I can, you know, do a full pregnancy update then. I'll do belly shot and all that. But that's about it for right now. I just wanted to come on here and update with the anatomy scan results of what we could find, what we could get. Thank you guys so much for watching, and I will catch you guys at my next video.